All right. Well, thank you. I thank you for inviting me. It is an honor and privilege to be here, and I am very excited to present Rosewood to you. I am a psychologist. I'm Dena Cabrera. I'm a psychologist, and I am the clinical director at Rosewood. So again, thank you. I want to tell you a little bit about our approach. I have I've been treating eating disorders for the last 18 years, so I started when I was very young, and very excited. My first job coming out of college, I actually entered eating disorders. I was roommates with two roommates, actually, who had eating disorders, and it was really fascinating. I came from a small farming community, actually in Delano, California, Central California, and my dad farmed grapes, and I never really heard of eating disorders. You know, I knew about disordered eating, and everybody was on a diet and all that, but when I went to UCLA, I had a roommate who actually had anorexia, who ended up going on and recovering, and she actually became a mathematician and is very successful, so that was really neat to see her journey. And then I also had a roommate who died. So not as I was a roommate, but years later, she had gone on to have a cardiac arrest. So quite, humbling. So that what got me interested in eating disorders and went on to get my degree. And so I'm very proud. So in terms of Rosewood, I'm very, to take a breath, a little nervous. We do approach, we're a spin-off, if you will, from the Meadows, which is a renowned addiction facility just right up the street. And so eating disorder facility started then. We have a holistic approach to addressing the medical, psychological, social, and spiritual complications. Excuse me. We do treat the underlying issues as far as looking at the dynamics that they come in. And I'll tell you, one of the things that I've really struggled with, excuse me, I'm a little nervous. This is very intimidating. I have done hundreds of workshops, and so being in a room full of scientists and surgeons, and it is quite, thank you so much. I think one of the most intimidating and challenging aspects of working with patients is the diverse population that we are experiencing. I think working with the contracts with insurances, we are getting so many different presentations at Rosewood, and part of that includes, particularly with the adolescents, we are getting patients not just with eating disorders, but with PTSD, with severe depression, suicidal ideation, self-injury. We have cerebral palsy. We have patients with developmental disorders like Asperger's. And then also another aspect is that we're seeing is like Turner syndrome, so genetic disorders as well. So it is quite interesting to see this presentation. And then we're not only dealing with the patients themselves, it's the families that are coming in with the severe comorbidity of bipolar disorder. And so having a model to treat these patients, I appreciate all the work that you're doing, because my job is to be able to deliver that to them. And one of the things that I find so fascinating is that I spend, whereas 15 years ago, I spent a lot of time working with them in treatment. Now I find I spend a lot of time engaging them in treatment, trying to get them to buy into recovery, and that's been the biggest difficulty. We have all levels of care, so ranging from acute care to residential to partial and intensive outpatient program. With the exception of our adolescent program, we do not have a partial program for them. We have a multidisciplinary team approach, including our medical provider, who is an addiction specialist. So that's one of the aspects that I think is really special to Rosewood, blending the addiction and the eating disorder piece. And then also a full team. And we have a staff development specialist whose primary role and responsibility is to train and keep our staff up to date on the latest aspects or latest research as it pertains to delivering care. And that is really a gift. We also include other ancillary therapies, including art, music. We have equine, we have ropes, we have yoga, tai chi. So really a whole multimodal approach to treatment. It is individualized, so each patient does have their individualized treatment plan, but we do have a standard delivery of what we want each patient to go through in terms of the program, looking at the function of the eating disorder, looking at their identity attached to the eating disorder, but also giving them tools and skills. So for our ranch program, we have 28 inpatient beds for males and females. We have a 7-day-a-week programming, so we do have therapists and staff there every day and programming every day. We have integrated addictions treatment. We have let's see if we can go back up. We have a Sonorum program, so it's a really nice, actually it's a building, where it's a really nice program where if we have medically and nutritionally compromised patients, we can actually give them a little more attention, a little more specialty in terms of the support that they need for meals, or if they're on bed rest. So it's a nice place that sometimes they're just completely overwhelmed, and so they can go back to this program and get that one-on-one meal support or encouragement and other needs that they need, nutritionally. We do have, we're very focused on trauma recovery work. We have trained and certified EMDR specialists, and we have a 5-day intensive family program, and this is for all levels of care, where they engage, the parents come, engage in a 2 to 3 day psychoeducational process, and then a therapeutic work that it's attached for 5 days. And they also, what's really cool, is we have the families come, particularly to the adolescent program, and do a lot of meal coaching, meal support, so they're involved with their loved ones in that process. Let's see. One of the beauties of, and I think of Rosewood, is our continuity of care. So really making sure our delivery of treatment is consistent across the levels. We have a partial hospitalization with residential living. Again, that's a 21-day bed program, males and females. And we also do the same model, but in a less structured environment. So what that includes is they're able, for example, in the morning, they do go to breakfast on their own, and then they have programming starting from 9 to 5. And then at 5, they do dinner on their own. So they have like a lunch, they have a lunch processing group. We have processing group throughout the day. We have different workshops, different groups, and so on. But it is interesting. At this level, what's really fun is we get to do a lot of outings, like meal outings. We take them to a restaurant. We take them to the grocery store. How does it feel to be exposed to these foods? How does it feel to have to buy foods? And just going through the grocery store and filling up the cart with all their unsafe foods or their binge foods, and being able to expose them through that process, and then talk them through being able to give them mindfulness or skills or tools that they need to get through that process. I'm very fond of my adolescent program. I've been working there mostly the last 2 years before taking over clinical director for the whole program, but there are 14 males and females, or beds, if you will, 12 to 17 years of age. And we're very focused on the level system. With this age, it's very much externally motivated. Of course, our goal is to elicit internal motivation. And so we work through the stages of recovery, so they get different privileges and different rewards and different outings if they reach different levels and different experientials. So level 1, level 2, level 3 is really consistent to where they are in their recovery. Level 1 would be medical and nutritional stability. Level 2 is a little bit more autonomy and privilege in their recovery. And then level 3 is opportunities to go outside of the program and do stuff like we take them to the mall and do gene challenges. We take them to Victoria's Secrets and trigger them in that way, trying on bathing suits. Anything that we can do to elicit those triggers so that they can use their skills and realize how difficult it is in a less structured environment. Again, we do include family therapy as a huge part of our adolescent program. We have individual and family therapy weekly, and then we do have the week-long family program. One of the aspects, I'll tell you, challenges, I love Dr. LaGrange's work. I love Dr. Locke's work, and I talk to them frequently in terms of how do you engage families just in the engagement in their treatment with their adolescent is very difficult. It is very difficult. I think we get, again, that diverse population where their parents are also struggling with addictions, bipolar disorders. And I'll tell you, I bet about 50% of the patients that admit to Rosewood, their parents are probably less involved than I would really like to see. It's really the families that I find I spend more time with, educating them. And what fascinates me is that we have so much education, so many resources than we ever did, on the web, and good groups like NEDA, like IADEP, like AED, and I still find a lot of time is spent with families, teaching them, educating them about eating disorders. There's still a long ways to go with them and in prevention. In terms of our main components, this is true with the adults as well, except for the educational program. We do a lot of diagnostic assessment. That's actually my background, doing a lot of testing. Try to engage them, particularly in neuropsych testing, if it's available or if it's possible, given insurance approval. We also do a lot of interventions. DBT treatment is a specialty of mine, so I include that in all our treatments across the board. We do DBT groups twice a week, but then we also integrate it into our individual care. Psychodrama is an experiential part, which is really cool, getting them into the emotion and just teaching them, observing and describing emotions. We adhere to, we keep them going in terms of their school program. We do have a nationally accredited A+ program that they're able to engage in, and oftentimes what's really fascinating about the dynamics with families is they get so focused on school and them achieving and succeeding that they forget, and I have to sometimes say, you know what, we're really focused on saving her life. And so school is important, but we're going to do first things first. And that's really my model, and I adhere to the DBT, life-threatening behaviors, therapy interfering behaviors, and then quality of life. And that's kind of how we address each aspect, because you can really get overwhelmed, as you know, with all these difficulties. I already talked about that. In terms of Tempe, this is a great location. It is prime. We are right across the street from Arizona State University, which has about 70,000 students. And so our program, yeah.
Just barely.
Yeah. It is awesome, and so we're right in a prime location, and so this program also includes outpatient therapy. We're 4 days a week of an intensive outpatient program for adolescents and 5 days a week for adults, and it includes individual psychiatric care, nutrition, and therapeutic sessions as well. And it's also includes our registered dietitians, and so it's a big part of, again, engaging in meal programs, taking them out on outings, taking them to restaurants, how do they order, taking them to grocery stores, how do they buy food to cook. So I think it's really awesome. All levels of care include group description, or the group description in terms of we do body image work, very intense body image work, as well as, again, DBT across the board. I think one of the nuggets at Rosewood is our aftercare program. We have aftercare coordinators at all levels of care who are helping and facilitating with that continuity and that transition. So right when they come in the door, we do a screening, we look at their referrals, we look at the resources that they have in their area, and we're already starting to set up appointments and making sure that it's ongoing, that they themselves are taking part of their aftercare and understanding that they have to continue, that Rosewood inpatient is this much time in terms of the big scope of the time that they need in treatment, in recovery. And then also working on readiness for change. And one of my, missions as clinical director is really supporting our staff in helping using those stages of change model in doing the motivational interviewing and helping patients engage in treatment. I spend most of my time on the floor, working that, looking at losses. We use a lot of Josie Geller's work, in focusing on, okay, what are the components that help them step from one stage to the next? And so focusing on losses is really what we look at pre-contemplation. And then when we get to contemplation, it's focusing on hope and building skills, and then focusing on action, really working, if you will, the steps to recovery. And then, of course, we do a lot of the meal coaching and support. So this is me. Now that I'm more relaxed and feel comfortable, I can continue on, but that usually happens. I'm one of the authors of Mom in the Mirror, and this is a stance. This is body image, beauty, and life after pregnancy. And after I had my 2 children and working with eating disorders, I realized there was a real need for mothers who struggle with body image issues, who struggle with disordered eating, and that it was a real area. And of course, a lot of times we're focused on trying to save their lives, but I really feel that in parenting with a disorder, particularly an eating disorder, not only affects their connection with their child, but also their recovery. And so lots of the chapters are about anxiety around food, preparing, food for your children, looking at your own legacy, and also building skills toward that connection and towards recovery. So that's me. And thank you. I made it. I made it.